This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and in the 2+ years I've been working on this program, we've devoted a fair amount of time to talking about the abuse of prescription medication. It's a serious problem in Mohave County and across the country. So I thought this week we would revisit the essential moments of those conversations. We'll hear from Dr. Sarah Knievel of Mohave Pain Management. We'll hear from Patricia Jacques, who is a counselor with the Arizona Youth Partnership. We'll get a survivor's perspective and talk with Jaimie Valdivia, who lost her sister to a drug overdose. And finally, we'll hear from Kingman Police Chief Robert DeVries. This series all began in a conversation with Dr. Sarah Knievel. Here's what she had to say.
Mohave County is 6th in the nation for abuse of controlled substances for people over the age of 12. 1 in 4 high schoolers and perhaps middle schoolers, I'm sorry if I don't remember it specifically, have tried a narcotic from their parents or family friend drug cabinet. And the reality of young people's impression of narcotics is that, well, it's in my mom's cabinet, so it must be safer than liquor. So a lot of people are starting to use narcotics more recreationally because the availability is that much more great than it was, 20 years ago. So there's been some changes that have occurred, mostly things that have been recommended by the government and the FDA, that has made it more difficult to freely dispense opioids, like, say, that was happening maybe 3 or 4 years ago in Mohave County. But there still is a huge, huge problem. And northern Arizona, New Mexico, parts of Nevada, Utah were probably some of the worst parts in the country. I'm
kind of a sissy when it comes to drugs, and
years That's fine.
Years ago, I had to have my wisdom teeth out, and I put that off as long as I could because I didn't want to be put under for that. Maybe it's kind of a control freak thing. I'm not comfortable around drugs or intoxicants, and then I think probably a lot of us are like one good car crash away from having a potential encounter with some serious narcotics.
Well, so medicines affect everybody differently. Yeah. And so when people are prescribed narcotics, even between families, one person may have a significant reaction to it. Another person may become very ill. They may not work for some people. But unfortunately, the truth is that narcotics are very addictive substances. And that is why the FDA has classified them into a category that requires further monitoring from the providers and the FDA themselves and your pharmacies. So, it's people who get addicted to pain medicines traditionally have a history of addiction, and it's not something that just comes out of the blue. But addiction is a very, very complicated process that involves more than just pain. There's a lot of family history that goes into it, home life. And all of these are elements that I try to ascertain or understand about patients before I enter a relationship with controlled substances, because I do not want to put them in a situation where, if they are significantly predisposed to addiction, I don't want to give them the opportunity to become addicted to something else. It's like giving a recovering alcoholic a drink. You just don't want to do that to someone.
Now, if it's someone who's dealing with some significant pain, what other treatment options do you have if it's someone who has a lot of those warning signs?
Well, there are a lot of other things you can do. There's other medications that are not as addictive. They're non-opioid treatments. A lot of them are neuropathic pain medicines. Lots of times even over-the-counter analgesics aren't used appropriately. Procedure-wise, there are many different procedures that you can do that can help subacute chronic pain, and they can be very successful. Surgery is definitely also an option in some circumstances. That's not something I practice, but I do refer to surgeons at times. And I don't want to scare people about using opioids. They're not bad drugs. They just have to be used responsibly. And I think that's the trouble that has occurred in the United States today. More people die from narcotic overdose in combination with other substances than they do for motor vehicle accidents now.
Wow.
It's the CDC states that opioid and other controlled substances is the number one cause of accidental death, which is tragic because 20, 30 years ago, these medications weren't prescribed at all unless you were a cancer patient and dying. But so I think the irresponsible nature in which these medications has been prescribed has resulted in a lot of bad things for our country and people dying because of it.
There was a physician a couple of years ago, I think, in Mohave County who got into some trouble he just sort of had a dispensary, I think, right?
Yeah, and I don't know too much about it. I haven't spoken with a lot of people in the medical community about it. Actually,
right.
I've learned more from reading the local newspaper.
Okay.
But my understanding was that and this is part of the problem, I think that there was a large pendulum swing in the way that narcotics were prescribed starting about 15, 20 years ago. Before then, like we discussed earlier, people only got narcotics when it was in a cancer or a malignant setting, and we didn't really understand the long-term effects of narcotics at that time because, a lot of those people died. But there was a large push from the pharmaceutical industry for financial reasons to promote certain medicines that changed the prescribing pattern of people in the United States. And around that time, too, it was discovered that it could be very profitable to have what was called pill mills. People seeing 50, 60, 70, 100 patients a day.
Wow. And
just prescribing medications.
Like 60 seconds at a time, essentially.
Pretty much, as long as it would take for me to write out what you were getting in my signature, perhaps. Which really is totally counterintuitive to everything that we just spoke about.
Yeah.
How do you avoid running into trouble with substance abuse or side effects from narcotics? And I know that there was a gentleman who was practicing like that, and he did get in trouble for Medicare fraud because he was billing so high. He was billing at levels that he technically couldn't have ever really done in a 24-hour day period.
Okay.
Now, I do prescribe opioids regularly. It is a large portion of my practice, and I think that if they're managed responsibly and patients can tolerate them without a lot of side effects, they are a treatment option for chronic pain. I don't want to make it seem like I'm not, for prescribing narcotics, because the reality of my practice is that we do prescribe a lot of pain medicines.
Right.
But it's a very fine line how it's done appropriately.
Yeah.
And obviously that man who is no longer in our country, he was not doing it correctly.
Yeah.
So.
I had a feeling, I didn't really know the details of that story, but I had a feeling it was something like that. Here is Patricia Jacques from the Arizona Youth Partnership. When I was at your presentation the other day, you showed a short film, and there was something really striking in there. It was about, they were mainly young people, and they were using these prescription meds. Several of them had lost their lives to that. A couple of them survived. Mm-hmm. One, not so much, just barely survived. There was a father who had lost his son to an overdose of prescription medication. And the father said something that really stuck out to me, and I actually wrote it down, and he said, I'm not sure if he even thought he was doing drugs. And we've talked about this before on the program, but there's kind of this idea, drugs, they come from the streets and they're cut with anything and they're filthy and they're, shady characters. Mm-hmm. However, prescription meds, they have to be safe, right? Because they come from the pharmacy and it's all sterile and it's, right?
No.
But they're still opiates.
They still have the same basic chemical makeup. Right. And that's what we're trying to help people to understand, that a lot of times people's perception of what an addict looks like mm-hmm. is very far from the truth. I know grandmothers and grandfathers that had to go into a program of recovery and detox because of their addiction to prescription pain medications.
Right.
So what you think an addict looks like is not necessarily the case. It could be the person next door.
You have lots of numbers and statistics, and sometimes they can become overwhelming. Something that really struck me was you had 44 orange pill bottles out on the table.
The latest numbers from the Centers for Disease Control, the CDC, are 44 people every day die from prescription drug overdose. Okay, 44 people. The bottles that you're speaking of are now on display. If you'd like to see that display, because they are people's lives, they have photographs in them. They have letters from loved ones. This was all part of our 420 event that we held under the London Bridge this year, when we had the National Prescription Drug Traveling Memorial Wall come to see us. It was a beautiful event in which we paid tribute, because nobody gets up in the morning and says, gee, I want to be an addict when I grow up. Right. Or, gee, I've worked so hard with my education and my career, I think I'm going to become a felon today. Right. It doesn't happen that way. It sneaks up on you before you've realized what has happened. So again, that's my job, to educate people so that it doesn't sneak up on them, so that they have an opportunity. And the windows, the shops at the mall in Lake Havasu City has donated window space to our organization, in which I go out and I do different things for each month. And this month we're doing back to school safety. So there's a campaign on alcohol. Are you locking your alcohol? When our children are little, it's kind of a no-brainer. We all know to move our cleaning supplies from the lower shelves to keep them up where they can't get a hold of them. And just because they go into middle school or high school doesn't mean that we can lose that due diligence. We need to keep our alcohol locked. We need to monitor it to make sure that our youth aren't getting into it, because a lot of this starts with alcohol. And then the prescription drugs. Are we keeping our prescription drugs locked? Are we monitoring how many pills are in each bottle? And paying attention. These are things that we need to do. So, again, if you would like to see the bottles, it's a pretty powerful statement when you walk up on a mall window and it says 44 people die every day due to prescription drug overdose.
It's time for a quick break on Focus on Your Health. We'll be back with more in just a moment. Stick around. And welcome back to Focus on Your Health. I'm TG LaFredo, and over the years we've dedicated a fair amount of airtime to talking about the abuse of prescription medications. This week we're revisiting the essential moments of those conversations. Up next is an interview I did in the spring of 2014, and I'm still hearing about it today. And I suppose that's a pretty good indicator that this one resonated with people. This is from my conversation with Jaimie Valdivia. She became an activist although she never planned on that. Her younger sister, Nicole, overdosed and died. And in the aftermath of that, Jaimie found herself speaking with audiences, found herself on the radio talking with us. Here's a little bit of that conversation. Tell me how it was then that you finally discovered that she was getting into drugs.
Well, I ended up getting a phone call, and that was on December 23rd of 2011. This was coming from one of her good friends. She contacted me saying that she was very worried about my sister, and she had tried to go to my parents and talk to them, and they basically, shoved her off and said, we'll take care of it. And then when approached again about it, the issue, they were, just mind your business, we've got it under control.
Yeah.
When she saw that wasn't happening, she contacted me and brought it to my attention. I have to admit, I did question her. Well, how do you know this? Are you sure?
Right.
No way, because we stereotype what people look like, and that didn't, look like my sister at all. I couldn't believe it. So I did question, and she said, well, because I've done them with her. And I knew right then.
And at that point, it had progressed beyond even the prescription medication, right?
That is correct. When the phone call was made to me at that time, my sister was highly involved with heroin.
So here it is a couple of days before Christmas, and you got that awful phone call. And what was your next step?
I actually went into the kitchen and looked at my husband, and I said, I'm going to Lake Havasu, and I'm going to bring my sister back. And I drove out there with the intent that if I had to kidnap her, stuff her in the trunk of the car, so forth, I was not leaving that town without her.
Right.
I had never been in trouble with the law, but it was worth breaking for that particular reason.
And describe the situation when you found her.
Well, it was roughly around 2:30 in the morning. I pulled up to a house. She didn't live there, but it was a person that she associated with at the time. And I was very, very scared. I had no idea what I was going to walk into. I had my friend on the phone in my pocket, being I'm alone. And it's the middle of the night, and I just knew that I had to be strong. I was there for a reason. I walked up and knocked on the door, and the door opened up, and it was a gentleman. I had met him on a previous occasion. Mind you, I didn't know that this was actually even his home. He was looking at me with uncertainty that, do I know her from somewhere? Kind of not sure, and obviously who'd be knocking on my door at this time of the night.
Right.
And I said, yeah, I'm Nicole's sister. I said, I know she's here. He said, let me go get her, and he went to go close the door. And I put my foot in the door.
Yeah.
And I said, no. No one's closing any doors. And at that time, another female came running out of the back bedroom. Behind her then came out my sister, kind of a deer in headlights look. So I said, we're leaving, Nicole, and I'm not leaving Lake Havasu without you.
And you said you'd kidnap her if you had to. But it didn't come to that, right? She agreed to go back to L.A. with you.
That is correct. She did. She stayed with me for about 4 months.
And it was at that point you realized that her drug problem went pretty deep.
Yes, definitely. I couldn't believe what I was hearing. This little girl that, I loved and adored, and I'm looking at, and she looks like a healthy individual, was doing this, and the severity of it. She was a terrific student, always on honor roll. She was involved in sports. She graduated high school. She worked. She she did it all. She, was very inspired. She was even going to join the Air Force at the time.
She had graduated and she was accepted to go to the Air Force even with some of the trouble that she had gotten into?
Yes, that is correct. Going back to, the trouble she had gotten into was, at that time was able to be overseen because of her age, and it wasn't that, severe. But 3 days before she was to leave, she got in trouble and got arrested again. And at that time, she was, no longer able to go to the Air Force.
Right.
She ended up getting very, very sad, depressed. She allowed it to eat at herself, and just a way to escape it. She got into using the pills again, getting back onto, harder drugs, and sadly from methadone pills into heroin.
It hasn't been that long since you lost your sister. It's been, just over a year. And, obviously you can't go back. You can't change what happened. How do you begin to come to terms with this? Are you angry about it?
I'm not going to sit here and say I'm not angry. Of course I'm angry. I'm angry at a lot of things. I'm angry with myself. I question, did I do everything that I could? I'm angry with my parents. Why didn't they do something about it sooner? I'm angry with my sister. But that anger is not going to help me, and it's definitely not going to change anything or bring her back. So the best way that I can cope with it is, continue to reach out to other individuals. And even if it's just one person at a time, helping them, saving them and their family, it means just so much to me. I don't want anyone else to have to ever deal with this pain.
That is the very courageous Jaimie Valdivia in our interview from the spring of 2014. And now a word with Chief Robert DeVries of the Kingman Police Department.
One of the things that really caught our attention was a few years ago when the Arizona Criminal Justice Commission contacted us to tell us we were number one. But that's not number one in regards to the type of award you would like to receive. Mm-hmm. What they were telling us, unfortunately, is that Mohave County was number one in the state of Arizona for prescription drug abuse amongst youth. That really hit us from that regard and put us on a track of partnering with as many agencies, as many people as we could to try and have an impact and drop us out of that category and hopefully save some lives.
Yeah. So obviously this is, as you say, not the kind of number one you want to be. And so when you, on day one, when you get that kind of news, what's the next step?
You begin to take a look at what are we doing, what aren't we doing, and how can we fill those gaps. And that's what we set on a path to do. We reached out to community members, leaders, and started to do train the trainers in regards to what's known as RX 360, or the prescription drug abuse training. Mm-hmm. And then we set a course and a plan as to how we felt we could begin to impact and hopefully drop those numbers.
Before we started this interview, we were just chatting, and you said you're coming up on year number 38. You might be mad at me for saying that on the air. You're coming up.
I started very young. We'll put it that way.
That's right. You were 12. You're coming up on your 38th year of law enforcement, and I wonder when you think about when you think about drugs, drug abuse, and what you've seen over the years, how has the complexion of that changed?
I think when I look back over my career, I think the most alarming thing that I'm observing, is the younger individuals that are getting involved in the substance abuse, and that's alarming to me because how that impacts them as an individual, how it impacts their learning abilities is frightening.
Yeah.
So we have continued to transition our approach from high school to middle school to the elementary schools. And it's the earlier the better that we and parents need to be talking to the youth about the dangers of the drugs.
And that's the show. It was a serious one, I know. Sometimes we cut up and have fun on the program. Sometimes we have serious business to do. I'm TG LaFredo, and you've heard from me. Now I'd love to hear from you. If you'd like to send me an email, you can reach me at foyhradio@gmail.com. That's Focus on Your Health. foyhradio@gmail.com. Thank you so much for listening, and we'll catch you next time.